So we were blessed with a son that is on the spectrum. We were blessed, my husband and I were blessed with our second born. We were also blessed. I am my mother's only child, and she is and was a, oh my gosh, I don't know, she's a guru in her, I called it a dinosaur. Back when FAMU, you came through that educational department and you had to know everything, right? But she was ESE certified, working with children everywhere on the spectrum, from gifted to those who had learning disabilities, right? So she was very familiar, had more than 30 plus years of experience. So when she recognized certain symptoms and saw certain things in our second born, she immediately understood this, right? So then what happened? So then we have this, and I'm doing a plug each time. We have this FAMU educated. My aunt is an OT. So of course they're there together, right? Talking about all this. My dad's sister, ESE superintendent up in Georgia. So she knew the law, right? So we kind of had our in-house information support system. She attended all the IEP meetings. She was in space. She could tell them if things were appropriate or inappropriate. She was actually schooling some of the folks because she knew what to do. And my aunt could tell them, no, he's on this level. We're doing these things to prepare him for an inclusionary education, right? So well before it was time for him to enter school. So in 2017, as he was beginning to leave a charter school that Remy had selected, it was actually 2 days before she passed away. And I was attending my first IEP meeting alone. And you really don't realize the jewels that have been poured into you and that you've listened to and captured through the process until you have to stand there in this space. My aunt, fortunately from Atlanta, the ESC director, was on the phone listening. She said, now I'm going to support you, but I know you know what to say and do. Well, I sat in a room with approximately 8 individuals with all of their specialties to tell me what they felt like Austin needed, what he did not need. And I recognized at that moment how much we were truly blessed, right? You don't realize these things until it happens. And so I was able to speak up and tell them, no, that is not who he is. I appreciate your opinions, but at the end of the day, according to the federal statute, you have to support him in these ways. So I kind of shocked people, even including myself, in that meeting, and I refused to sign the agreement, which a parent has a right to do. I left. It kind of was a whirlwind after that because my mother, like I said, passed away 2 days later. But I remember her words to me very clearly growing up. And she said, you can cry, but you cannot quit. It's not an option. And that much is given, much is required. So during the healing process of losing my mother and walking through these spaces, I truly understood the impact of what it means to be supported in a space where you are entrusting individuals with your greatest joy, right? Your children. And so, although very hurt, very wounded, I realized that you can't take that and just lay in it, right? And that I had to do something. What would my mom want me to do? What would she expect of me, right? She would expect of me to take all of these jewels that we had been given by herself and my aunts, because believe me, my aunts, they jumped right in and they were on either side after that, in the IEP meetings and so forth. But to cultivate an area where parents who never had that type of support, right? They didn't know the language. They wouldn't even know where to begin, right? They know something is there. They know something is different, but who can they really trust? Because, we had our family. We trusted them, but hey, they were doing it. And so we were like, hey, we're blessed. But not all families, especially families of minority communities, right? Or socioeconomically challenged communities, do they have those resources in-house? Like we could legitimately leave and go away because they knew what to do if he had a meltdown per se, or things that happened. They just knew what to do, right? And then their family. So the passion came behind my husband and I just missing my mom, because She was here every single day. Those boys, our 3 boys, were her world. So my husband co-founded this nonprofit with me. He said, you know, you're going to do the work. I know it. I know you feel passionately about this because you want, throughout your life, you've always said, when we see our boys doing well, we want to share the information. If there's an access to information, I shared it with everybody. I don't believe in hoarding it, right? Because when our boys get older, we want them to look to their left and their right and see people that look like them, that had the same opportunities, right? And we want families to feel secure in spaces, regardless of their matriculation or their educational background, regardless of where they come from on that side of the tracks, right? Regardless of any of that, that's their child. And so they deserve to have a space where they are heard and respected. So that's where the passion came from. It came from knowing that my mom would expect nothing less. You can't just wallow in it. You have to get up and you have to fight. It doesn't stop. The oldest child that we have in our family that is on the spectrum is my nephew Dre. And so my cousin Taj, that's her son, her and her husband Elle, Dre is 31, I think now. He's 31. He's nonverbal, but he did graduate from high school. He does well. He communicates signs and all of those great things, right? But in the season that Dre was born, Taj was out there on the front lines, right? Because people did not, especially in the African American community and minority communities, let's just be honest, there were cliches about him. They wanted to call him something else. Some people even were derogatory and used the R word, right? They did not say very nice things. But she knew her child was intelligent. She knew there was something inside. Just because he wasn't speaking did not mean that it was a specific diagnosis, and she realized it. She traveled to California to meet specialists, Georgia to meet specialists. Like, she dug in and she hit the pavement running. And in the years that she has done that, also another access and resource that we had in the family, in those studies, we have watched it grow. Since 2002, actually, it's almost doubled the number of diagnoses with autistic children, right? But in 2021, we're doing a study with JAMA, Journal of American Medical Association, noticed that in minority communities, the numbers became stagnant. Why were they becoming stagnant? Well, we have a lot of different reasons why that may be, right? And I equate them to external barriers, which may be misdiagnosis, not culturally competent medical and clinical mental health providers, right? So that creates a distrust, right, in these communities that are directly affected by it. But also, I am a big proponent of doing self-work. So I talk and speak to my own community members about, we have some internal barriers ourselves, right? We have some internal barriers as it relates culturally to recognizing or wanting to recognize that there may be some assistance that our children need from a mental health and emotional standpoint. We have stigmas about what an IEP means, what a 504 means, and our children being labeled, because we already feel like they have barriers that exist within education. So we want to put another label on top of that and, have people prodding or feeling like someone is going to come in and look or question our parenting even, right? And that's a long line of just generation after generation. You keep folks out your business. You don't always have them. I find that even in a lot of the lives that I do, in the context that I do it in, parents, you won't see them. No one comments. But after, I have people just reaching out to me, asking for resources, trying to contact me. And I respect that. I respect them deciding how and when they want to share that. I mean, and I don't care if the parents have a PhD. I don't care how well they have, matriculated or their status in society. There are some things that they just keep close to heart, and that's their children, right? And so they don't want to share. And a lot of people would be very surprised at those families that have people, cousins, children per se, that it takes them a while. It's a grief process sometimes that goes through. I don't want to recognize this about my child. I'm concerned. I don't want someone to say something to him. But it comes from a genuine place of, if I am unable to help my child, what if I'm not able to give him what he or she needs, right? And so, again, that change agent that goes in to work and acknowledge these barriers that exist externally and internally, and realize that we need to address them. And they're not going to go away, and no one's going to come save us. We have to do the work ourselves every single day and acknowledge it. So that's a big factor with barriers. And we're hoping to bring more culturally competent, especially, and a lot of people wait for the pediatrician never said anything. Well, the American Pediatric Association right now has a subcommittee working with people that are on the spectrum to find out how to train their pediatricians. There's not a lot of information that pediatric doctors receive unless they decide to specialize, unless they have come in contact with children who have recognizable ASD behaviors that the parent brings in and articulates appropriately. But a parent may not know how to articulate that to their pediatrician, or the pediatrician may say, well, they'll grow out of it. It's one of those things that happens, but it's not. And so unless parents are able to articulate it, unless parents are able to discuss these concerns that they have, they often feel like they're blocked in. They don't know what to do. They know something needs to be done, but they're just not sure what it is and how to attain it. So over the last, I will say, 4 or 5 years since delving into this, I've noticed that there are entities that have dealt with autism, right, that now are recognizing, wait a minute, let us look around. You're right. There are not any diverse people in this room. Everyone kind of looks the same. So they want to now reach out to communities of color, other ethnicities and cultural dynamics, socioeconomic dynamics. They want to reach out to them, but because they've never been in these environments, they've never been in these communities, they don't understand or respect those barriers that exist, it's not happening. So we're asking those who genuinely and intentionally want to work and reach out to these communities to please let us know. Come in, allow us to do training for your staff, intentional training. And intentional means that I'm studying what I want, and I'm going to respect what I go into, even though I may not understand it. It's being intentional to be diverse and inclusionary, because I'll highlight this as well. Young women are often not diagnosed as much as boys, because the symptoms and the behaviors in young women show up also differently. And so because of that space of inclusion, there's only one face that's showing up in those spaces. And we believe that our community partners, if they would meet with us, allow us to come in and train, allow us to go out with them and establish their protocol, and then have an auditing system which comes back in so that we can review what exactly are you doing. Let us follow some of your people into these spaces and realize that unless they trust you, they're not coming. And those dollars and grants and all of that money that you're receiving is tied to serving all people, not just one community. And so in order to do that, that's what we're here for. We don't mind partnering with the big boys. We understand that you all have, kind of a lock on it, and that's fine. But ours is a kind of boutique nonprofit that says each parent, each family, each household is important. Every single one of them. And they have a culture of their own. Because just because you see a Black woman, I could be from Pennsylvania, or I could be from Ghana, or I could be from the Caribbean, right? And just because of a skin color doesn't mean you necessarily know their culture. The dynamics are very intricate and detailed. And that is what is required when you're talking about service work, especially with children, because people want to know that you are in tune to what they do. You don't have to understand it, but you have to take the time to try to understand, and you must respect that space. If not, early intervention is not going to happen, and it's going to cause further discrepancies and disparities in our educational system, because there's some children coming in that have not been diagnosed, and their behaviors are then seen as behavioral issues, right? And they're not behavioral issues. They are sensory issues. I've never sat in a classroom or been around this much stimulus in my life, and it's causing me to be, kind of overzealous, and I'm crying and I'm screaming and I'm balled up in a corner. That's not a behavioral issue. That's not a child being spoiled. That is probably an undiagnosed child that just doesn't know how they have those, as my mom would call it with Austin, self-soothing mechanisms. And those are necessary, right? Those are necessary to allow them to be successful in those environments.
I like that. Yeah. I like that a lot. And what areas within the youth services area would you like to see growth or more of? What would you like to see more of in Leon County in terms of youth services here locally? And in what areas, as well, just to balance the question out a little bit, right, what areas have you seen it grow? What areas have you seen Leon County become a leader, or more so advocating in areas in youth services that have been a positive?
Well, definitely a positive. Leon County Public Library reached out to us this year to be a part of their neurosensory fair. We took part in that. So we were there, and they had youth services there that reached out, whether it was from early intervention to transition out of high school into the workplaces and things like that, right? And when you have that space where you can bring youth in and youth services in, wow, we were floored with how many services there actually are, and they are intentional about creating spaces, especially at Leon County Public Libraries, for sensory specified areas and times, right? Because they just need that space. And so they're very intentional about that. I am watching how there are art, Somo last night, love the Sissels, because they are very clear. She's an educator by trade. And so in those spaces, they're very intentional about being inclusionary in those spaces, because it also not only is the acceptance of neurodiverse children, but it allows children that are atypical children, as my son calls them, atypical children, to gain an insight, because many of them haven't been around children that they know are autistic, right? Or they've never seen children in spaces that are either Hispanic or African American that are autistic. And they're like, what? Okay, you're autistic? And it gives them a better understanding. And then they can say, you know what, I have a friend